Subscribe to our YouTube channel and press the bell icon to get the latest updates.
The number of new active COVID cases have now started declining. Thanks to the lockdowns, thanks to people behaving better, the vaccines, as well as protection that comes from having had COVID. We've seen recently that the number of cases are coming down at 2.4%, and this is going to have a positive impact on the economy. To look at this, my colleague Renuka Sane and I have a column whose link will be given below. Let me just take you through the logic of why we think that if you look at the economy for the year as a whole, then we'll actually do slightly better than we thought we might. Last few weeks have been full of so much uncertainty that the main reason why that fear was going to have an impact on the economy was because healthcare was not available, and it was fear of lack of healthcare, because of which people started not coming out. Consumption demand started declining, and the forecasts about the economy were getting poor compared to what they had been earlier. Now, to go through those list of reasons, let's just start with first is the fear of the lack of healthcare. A lot of lives were lost when people were scrambling to put together oxygen and hospital beds and were unable to get healthcare on time. As we have, in the last few weeks put together these facilities, the situation has improved slightly. Initially, in a city like Delhi, the sudden increase in the demand for oxygen, which was about 10 times the normal oxygen demand, could not be met in the city. And we saw that people died because of lack of oxygen. As the situation eases, we are expecting that the fear of lack of hospital care, of health care, will actually reduce, and this will help improve the situation. The second factor is the decision of 19th of April, much criticized, of course, where the government said that instead of just the central government providing, rolling out vaccines, which they will continue to do for age above 45, the state governments, institutions, employers will be able to get the vaccine, procure it themselves, and administer it. Now, this, of course, means that a lot more energies are being diverted. A lot of people are trying to get vaccine supplies and to administer them. But what is less understood is that this is good for a third booster dose, so that when the time comes to roll out a third booster dose very, very fast, then the institutional arrangements, the experience with having given vaccines would be there with the institutions and with employers and hospitals, so that they are able to roll that out fast enough. For the economy, looking forward, looking a year ahead, this is good news. Now, the protection that people have is, of course, partly due to the lockdown, social distancing. But apart from that, the protection that they have is both on account of vaccines and account of their recoveries. So in addition to the 18.7% doses that have been given, some of which are to the elderly who have been given 2 doses already, but for the rest, there are also about 2.2 crore people who have recovered from COVID. These people who have recovered from COVID are those who also have a protection. In the data, we see that Maharashtra has 1 in 5 persons being protected because either of a incidence of disease or because of the virus. Similarly, when you look at consumer sentiment, though consumer sentiment in rural area remains very poor, in urban area we have seen a slight improvement in consumer sentiment as COVID cases have started declining. So in the last week or so, between 9th of May and 16th of May, we are seeing a slight improvement in the CMIE consumer sentiment. Google mobility data is showing that there is now a 56% decline in people going to their workplaces. This again is something because of lockdowns, and that is likely to improve. And last, the global economy is improving. Export demand is expected to improve as the world picks up. In fact, that is now visible in the data. And we see that in the first week of May, export grew by 80% more than in the corresponding week last year. So last year, while there were supply issues because we had a lockdown like we have in many parts of the country here today, but the global demand was low because the whole world was facing COVID or facing lockdowns. And now that the global demand is picking up, we see an increase in exports from India. So overall, the second wave has caused much grief, much distress, loss of lives, loss of health. But looking forward, if we are able to provide healthcare and these fears reduce, then the economy may not look as bad as we thought it might. I'll take questions on this and much more on Tuesdays at 4. So please do send in your questions. Thank you.